On the northernmost tip of the island of Grenada is a place that is at once scenic, sacred, and historic. There, over 370 years ago, on a precipitous cliff overlooking the calm Sates Bay, about 40 Kalinagos people, the original inhabitants of the island, hurled themselves to certain death rather than surrender to French colonists. The French named the site Leapers Hill to mark the fateful event. Here too, on this same beautiful seaside cliff, in a small cemetery just yards behind an old Catholic church, is entombed the remains of a man who, by his ambition and suffering, contributed significantly, though inadvertently, to the annals of medical history. He lies buried there in a plot along with other family members. He was born Walter Clement Noel in 1884 to a relatively well-off family in the parish of Sates on the tiny Caribbean island. His death 32 years later was diagnosed as asthenia from pneumonia. But we now know that his illness and ultimate death was the result of complications from sickle cell disease, a painful hereditary blood disease affecting primarily people of African descent, but is also found in people of Mediterranean, Asian, and Middle Eastern descent. In fact, almost every ethnicity is susceptible to the disease. At the time of his death, there was no medical diagnosis for sickle cell disease, and consequently, no treatment or cure. If you can't identify it, then you can't attempt to treat or even advise or offer precautions. The disease itself is not new. The afflicted have been observed and reported on in the 19th century and before. In his 1872 book entitled The Diseases of Tropical Climates and Their Treatment, Dr. Africanus Horton, a British-trained Sierra Leone doctor working in West Africa, described conditions of recurrent bone pain in some of his patients, as well as documenting the association between cold weather, fever, and joint pain. The journey to the discovery of sickle cell disease actually began with a journey of a different sort. After completing his secondary school education at Harrison College in Barbados in the summer of 1904, Walter returned home, and then in September of that year, boarded a steamship headed for New York. He was accepted at the Chicago College of Dental Surgery to study dentistry. From New York, he would make his way to Chicago and begin his freshman year at the college. Let's pause here for a moment to consider the exceptional nature of what I just said. A black student from a tiny island in the Caribbean is admitted to a white medical school in the United States during the height of the Jim Crow era, a period in America when blacks were systematically segregated, discriminated against, brutalized, and lynched. It is not that there were no other blacks who attended white medical schools during this period. There certainly were. In fact, in 1905, there were 212 black doctors who graduated from white medical schools. However, they were primarily Americans and possessed exceptional qualifications. The other 1,253 black doctors at the time graduated from black medical schools such as Howard University. What this tells us about Walter is that his scholastic achievements were good enough to impress the school's admissions directors, who we can confidently wager may have never heard of Grenada. However, his acceptance also highlights the fact that his mother had the financial resources to send him abroad to school. There isn't much information on Walter's health growing up as a youth in Grenada. However, we can assume, based on the nature of sickle cell disease, that he was probably frequently ill from birth and suffered from intense pain in his joints and limbs. Since there was no diagnosis for the disease, he was probably treated with common home remedies and whatever the local doctor may have diagnosed his condition as: rheumatic fever, jaundice, pneumonia, heart disease, etc. During his voyage, Walter suffered an acute episode of the disease and had to be treated for skin lesions, joint pains, and respiratory problems on arrival in New York. Throughout his 3 years in dental school, his symptoms persisted, but they never dissuaded him. He sought medical attention at the Presbyterian Hospital, where Dr. Ernest Irons, the internist who attended to him, performed a peripheral blood smear and discovered many elongated and pear-shaped red blood cells, some small. He discussed his findings with his medical supervisor, Dr. James Herrick, but their analysis did not lead them to a conclusion. In November 1904, Walter's respiratory problems worsened, and he was hospitalized for 2 months at the Francis Willard Hospital in Chicago. After his discharge from the hospital, he returned to school, and Dr. Irons continued to follow up with him, even making house calls to treat his ailments. If you find this unusual today, think of how much more unusual it must have been in 1904. A white doctor at a white hospital following up on a black foreign student. However, several factors conspired to endear Dr. Irons to his patient. He described Walter as bright and intelligent, and we can assume that he was also impressed by his ambition and personality. No doubt, he was also drawn by the curiosity of his peculiar ailment and empathy for the suffering of a soon-to-be medical practitioner. Walter graduated in 1907 and returned to Grenada, where he opened up his dental practice in the parish of St. George. One of his patients described him as smartly dressed, healthy looking, and plump, with a dark coffee-colored skin, a round fat face, and a good body. Meanwhile, in 1910, Dr. Herrick, utilizing the notes that Dr. Irons had prepared throughout his care of Walter, published a report based on the medical observations of the patient. The report was created for the Archives of Internal Medicine, but it did not ascribe any credit to Dr. Irons. After the publication of the report, new observations of pear-shaped red blood cells continued to be reported, and in 1922, Dr. Vern Mason named it sickle cell anemia because of the unique sickle-like shape of the deformed cells. In 1949, the chemist Linus Pauling, known as the father of molecular biology, was the first to refer to sickle cell anemia as a molecular disease. Hemoglobin S is a protein within the red blood cells that carries oxygen throughout the body. Patients with sickle cell disease inherit 2 mutated hemoglobin S genes, one from each parent. In such cases, the child will have a 25% chance of developing the disease. There is also a 50% chance that the child will develop a trait and live a normal life, and a 25% chance that the child will not carry a trait or have the disease. The mutated cells are sticky, rigid, and shaped like a sickle. As a result, it is difficult for blood to flow easily through the smallest veins due to the shape of the mutated cells and the fact that they also clump together. The result is intense pain in the bone, joints, and other parts of the body. As certain areas of the body, the lungs, kidney, heart, and lower extremities, become starved of critical blood flow, they begin to fail and become progressively worse over time, usually resulting in organ damage. Ultimately, the patient will succumb to the onslaught of complications. Thus, the death certificate of a sickle cell patient may show pneumonia as the cause of death, when in fact, the pneumonia was a complication of the sickle cell disease. Such was the case of Walter Noel. There is currently no widely available cure for the disease. Blood stem cell and bone marrow transplants have recently been used to reverse the disease in children. However, the procedures are deemed too risky for adults, although current clinical tests are proven to be very successful for adults. Not many young people make it a priority to write a will. However, Walter did. He was no doubt familiar with the symptoms and regularity of his illness, and aware of the low longevity rates of his family. His father died of renal failure at the age of 37, 2 years after Walter's birth. His sister Jane died of pulmonary disease at the age of 24, when Walter was 15. It is reasonable to assume that his mother would have discussed the topic of his illness and the family's history with him. It is also logical to assume that given the ages and causes of their deaths, both his father and sister may have succumbed to the ravages of sickle cell disease. It is probably why Walter never married or had any children. Walter died in his home on May 2, 1916. His doctor diagnosed his death as pneumonia. He died not knowing that an article was published about his disease based on what was observed when he was a patient in Chicago, or that he contributed, unwittingly, to the identification and study of a disease that has claimed the lives of sufferers for centuries. My parents were Grenadian born, and they both carried the sickle cell trait. Unfortunately, my younger sister drew the short straw and succumbed to the disease after a long and arduous battle. For the first few years of her life, her doctors were unaware of her true medical condition and treated her for a variety of ailments, including rheumatic fever and heart disease. Later in life, she was properly diagnosed, but treatment for pain and relief of severe symptoms was uneven, often depending on the level of awareness of the disease by the doctors and hospital staff.